you're arguing with yourself or trying to like convince yourself of your own worth. It might be like worth as a therapist, worth as a human being. And I think that process is often running in the background unnoticed. And when people come to us, we can notice that. And if we slow down long enough, and we can notice that in ourselves too. Like I treat my own internal experiences sometimes as something that needs to be like taken out or fixed. But I think there's just something more there, something deeper.
Welcome back to Act Root to Fruit. My name is Marcel Tassara, and I'm on a quest to dig up the roots of the contextual behavioral sciences. This is a podcast about getting deeper into the behavioral underpinnings of acceptance and commitment therapy, functional analytic psychotherapy, clinical behavior analysis, all of the therapies that fall into the contextual behavioral sciences. My agenda here is how can us clinicians have a deeper appreciation of function. So what I'm after here is speaking to some of these luminaries to get some insight and some guidance on how to be more effective, how to intervene and be precise with my interventions, in hopes that you listening follow along with me on this journey. If you've been following along, I appreciate that. If you're new, appreciate you too. Feel free to subscribe or like, review. One of my primary motivations for doing this project and this podcast is to be helpful. Just imagining a world where more clinicians are basing their interventions on function. And so if your interest is in getting there and would like to do so in a group setting, hit me up. Organizing some training groups to do some experiential work and some didactic work around these principles of what I've been getting at here. With that, let's get to the show. My guest today is Dr. Yash Bhambhani, who's a psychologist at the Montefiore Medical Center in New York and also an assistant professor at Albert Einstein College of Medicine. His research interests include use of ACT for minoritized populations, particularly men of color who have sex with men, and for substance use. He's from India. He is a graduate of the University of Mississippi with Kelly Wilson. And I hope that you'll allow yourself to slow down with us as we talk about appreciating. So I have a few things written down that I thought would be fun for us to talk about, and I'd like to know what would be of interest in your passion zone to talk about in terms of this stuff. But the talking about the difference between the processes being processes over just kind of a cookbook. Something you mentioned before, I think is could be really helpful to folks to think about. And then I mean, I'm interested in your dissertation and how, especially this idea of like body image flexibility. I think it's a really interesting topic, and I mean, intersectionality of how that stuff comes up in play. Is of interest. What are you thinking? What's?
I think all of that blends for me. Like in terms of ACT processes, I've always found that it's like people learn through experience, I think, as opposed to like, it being a cookbook. It's more, of course, cookbooks are helpful too. I think, protocols, when we have them for certain specific situations, can be helpful. And I think often the people that we work with are much more complex and have much more complex situations.
Which means I need just a few more cookbooks, right? Just need
I don't know about that. I think I like where we're moving as like a field a lot to like, principles and processes. There's a lot of interest even in the CBT world and process-based CBT.
Yeah.
But I think there's a deep like slowing down and sitting in the processes that therapists can benefit from. Like that's what I found to be very beneficial, as opposed to like reading more. Reading more is helpful, and also experiential work, I think, is very helpful too. And that's why whenever I go to like ACT workshops, people talk about like how much they've enjoyed experiential work.
Yeah.
Just like seeing how those processes work for themselves and noticing in the moment like how acceptance shows up for them, you know. Like often in therapy, I'm talking to someone and I talk to some like supervisees about this too, or people that I like do peer supervision with. That moment in therapy when you're like kind of just like, I don't know what to say next, or I don't know what do I do. It's just like that moment happens often, and I think my instinct is to like figure out what to say next, or to like, you know, as someone's talking, think about what to say next. And sometimes that's not that helpful, because then I'm in my own head more, as opposed to like listening to the patient.
Yeah. I'm often pulled by that rush, being in a rush, and you know, getting it right.
Yeah. That's for me, I mean, of course I work with Kelly, so a lot of my training is different. People do act differently. Most of my training was with Kelly, so that has been most impactful. And there's a metaphor that he uses in his book, Mindfulness for Two, that metaphor of like, you know, are people a sunset or a problem? And I found that to be really, really, really impactful.
Yeah. How does that steer you?
Like people walk around, you know, whenever people walk around in the world feeling as if there are problems, and their internal world is a problem too, like something to be solved and something to be managed. Because often, like, I mean, I wondered if you've noticed this yourself too, and people have noticed this whenever they feel something uncomfortable or distressing, we kind of go, you know, to like solving that internally, like what to do about it. And then begins this like internal match where it's basically like a tennis game where you're throwing the ball, you know, and you're arguing with yourself or trying to like convince yourself of your own worth, or whatever that might be, like worth as a therapist, worth as a human being. And I think that process is often running in the background unnoticed. And when people come to us, we can notice that. And if we slow down long enough, and we can notice that in ourselves too, not to say that I don't have that, or that I've somehow like conquered that or like moved past that. Not at all. Like I notice that in myself too. You know, like I treat my own internal experiences sometimes as something that needs to be like taken out or fixed.
Yeah.
But I think there's just something more there, something deeper.
I'm wondering about this appreciation and how you go about convincing someone that that's enough. I worded it that way on purpose.
Yeah. Interesting. That's an interesting point of noticing and tidbit, because I don't think it's about convincing, and that often seems to be the case. Like that if we just convince ourselves of our worth, that we can do more. If we convince ourselves that we matter by whatever way, like, you know, by having a relationship, by having the next job, or that will be enough. That's often not. Instead, I think what I hope to do is to help people, whoever I work with, help them notice that they can have these thoughts and that these are products of their history and these feelings, and carry them with them, carry those thoughts and feelings with them, and still do what matters.
Yeah. So staying on the experiential.
Yeah, and for a purpose. I think that's the other key piece, values and purpose.
Yeah.
For me, often that has been people I love and people, like, for example, my brother. He's 5 years younger, and when he was born, it changed me in some way, and I felt like this, as if like something existed outside me that I loved like crazy, and loved so much, just like that I could not, couldn't describe it, and that's, I return to my people I love often, and how they might carry that because they have a version of that too. Mm-hmm. And I see them having it, and like that's something that drives me.
Yeah. Do you find yourself bringing that into the therapy room with you?
Yeah, like why that matters to me, and in the therapy room, it's also like why I do this work, because it's meaningful to me. It's purposeful, and it's like what might be possible for a patient or a client. Like that also matters a lot. And learning to know them and their story and what they care about. Yeah. I think that can anchor the work in ways that convincing doesn't. Because convincing is about making myself feel something.
Yeah.
There's something more there's something else that can be more important than convincing.
And that quality of appreciation is it's a very rich and deep recipe.
Yeah. And it's moment by moment. It's by noticing, and it's by pausing. Like there's loose guidelines around it. There's no this do this next and do this next and do this next. And that can be frustrating at so many times, because so many times when I'm working with people, I feel like, what am I doing? Or why can't I create change? Or why can't I be better? What am I?
I've never experienced any of that in my
right. Yeah. It's like the birds in the background saying like, why can't I be a better therapist?
Yeah.
So, but I want to come back to like what you said, like, as for minoritized populations, people who've experienced, historic marginalization and continue to experience oppression. There's an emphasis in ACT on changing context to change people's behavior. And I think in therapy, that might be me as a therapist and then, a client or a patient. But we can just take that broader and look at like public policy or like the context in which people exist, environment, policing. Can't help but think about, like, you know, the Chauvin trial verdict is going to be released in the next half an hour.
Is it? They've come up with it. Oh, wow.
Yeah. Jury came to a verdict, and they're going to release that in the next half hour. And like, how do we make the context better to help people thrive?
Yeah.
And I think we can do that work on several levels. And other people have said this in more elaborate words than I have, but like on the individual level, on the group level, societal level. Yeah, and I think that's the need of the hour.
Yeah. Yeah.
And for CBS work or for ACT work, when people are working at the individual level with people who might be different from them, I think there's this piece of, like, again, slowing down and noticing those differences, and really getting comfortable, or really just getting present and willing to feel that those differences and whatever discomfort might come up.
Yeah. Yeah. And I think for myself as a cisgendered white male, making sure it's really important for me to make sure I'm creating an environment where it's like anything's on the table.
Yeah.
Because it's so easy to keep things in a box and put them away, and then we all just kind of follow along, you know?
Yeah. And so much of that can also be about, we don't want to hurt people. And I think this work requires a level of vulnerability at times where we will make mistakes, and we'll have to repair, and doing that.
Yeah. I also want to go back, unless was there somewhere you were feeling pulled to go with this right now?
Not right now, I think.
Okay. All right. Well, I think I'm interested in, you talk about this, like appreciation and the guidelines of appreciating. Can we talk a little bit about some of that and how you're steered?
I think, again, I feel like we're heading towards, like, let's figure out the steps territory. It feels like that. I don't know.
You said guidelines. You said loose guidelines. So
I know. Yeah. It feels like,
blame yourself on that one.
Exactly. Yeah. And that feels more like steps territory.
Okay.
But I think, like, when I think about working with people, I want to, like, understand and know them. More than understand, I want to know people's experience. Like, what makes them do XYZ? What makes people drink? What does it take away? What pain does it wash away? Like, what pain comes back when they stop drinking? What matters to them? So there's several processes there. One of them, is like curiosity, if, like, stepping into another person's experience and really knowing it. And if I start to question, they'll start to think, of course, or like it'll come to the forefront, and they'll spend more time on it. And then, of course, there's processes of like willingness, diffusion, acceptance side, where you're like, whatever comes up, comes up.
Mm-hmm.
And that might be painful, that might be sad. But would that be worth something? And has trying to run away from that sadness worked? One of my patients recently actually talked about getting a piercing, and talking about how that was like initially very painful, but later they appreciated it, and they said, you know, they really liked the piercing, and that looked beautiful. And I kind of related that to their experience being, you know, feeling sad can be painful, but if attempts to like make that sadness go away haven't worked, can we let that stick around and still do what might be good for you, like going on a walk or talking to a friend? Yeah. And I think a part of this appreciating is also noticing our tendency to fix and our tendency to like want to problem solve, which is like,
as therapists,
as people, as humans, which again, in itself, there's nothing wrong with it. But if you rely only on that, that can be like different situations require different approaches or different, we need behavioral variability. If you just use problem solving exclusively, that might not work, like with our own experience, with our own internal experiences. So I think pausing is one of those principles, I would say. Is very helpful in any moment, just like noticing what's going on now. And there's a lot going on at any point of time. So in the spirit of that, like, I want to invite you to pause and notice what might be going on for you.
There was some busyness, and then it kind of fizzled as I paused. It was, you were going on for me once I paused. It wasn't. It kind of,
And what was the busyness about? Like, just briefly.
Just thinking about my problem solving, and I was thinking about how important it is for myself, and I was thinking about how important it is to see how I can be directed by other people's anxieties and other people's emotions, you know.
Yeah.
And that pulls me into problem solving.
So you're problem solving.
Yeah. Mm-hmm.
And again, like, nothing wrong with that at all. And I think being pulled by people's feelings is and being cognizant of that is extraordinarily human. And at the same time, I think there's something in there about like almost fragilizing. If people are feeling, you know how we respond if someone's feeling sad or anxious, we move to like fix that and
console.
Yeah. And there is absolutely a place for that, and not to say that there's not. That is very needed in times, and at times maybe we over rely on that. Like if someone's parent is dying, there's nothing I can say that will console them.
Yeah.
Or like when someone's experienced racism or like acts of racial violence, racial trauma, there's nothing I can say that will take that away.
Yeah.
At the macro level, of course, I can engage in actions that are consistent with my own values to like change the context on the individual level. Like with grief, for example, I can sit with them, and I can pause. I can be curious about it. Ask what that's like and what they're going to miss about their mom.
Yeah. Yeah, I find that it's something that we crave, is to be kind of shepherded in that way.
Say more about that.
You know, well, I mean, we live in a society that, and we not only do we live in a society, but I mean, it's really an extension of our mind that everyone, you just, you know, we're okay. You're doing fine. You don't, you know, and not being okay is not okay.
Yeah.
And so having a space where it's okay to not be okay is very liberating.
Yeah, I love that.
Yeah.
To a space where to be not okay is okay.
Yeah.
That makes me think about like that's why the vulnerability is such a hard word, and something that's often talked about. And
yeah, you want to, you know, get people's attention. I don't know if anything. And I would say, you know, the how do I say this? Just like a white guy crying right now is probably one of the most attention grabbing things there is. You know, that's a showstopper. You know?
Yeah. Vulnerability. Yeah.
Or just a man, you know, I mean,
yeah.
You know, it's just, you know, it's, and it's an act of courage really right now. It's reinforced, I think, socially quite a bit.
Yeah. Which is also, it made me think about how when women cry, that can also often be punished, like in public at least, you know. But when men cry, it's considered to be like a strength of like emotional, you know, it's an emotional strength.
Yeah. How is that in India? How is that different?
Similar, very similar. Yeah. I think sexism permeates all our cultures. Like at least here and in India that I know of often. Some things are womanly, some things are manly.
Yeah.
And I think that's why like our behavior is so inseparable from context and, you know, the environment that it occurs in. And I think that's really useful. to remember whenever we work with people, and just think about like, what, and it's very trauma informed too. Like instead of like, thinking about what's wrong with people, what happened to them.
Yeah.
That's causing them to behave in some ways.
Yeah. Yeah. That's what I appreciate about the functional perspective, is it's like just a viable roadmap for what you just said, making sense and offering some new ways of being.
Yeah. I really, I guess, hope to see, and I want to do more of that myself too, like see how ACT can be used in those spheres where like, people have experienced marginalization, minoritization, and to create changes there.
Yeah.
There's some work, like for example, there was a paper where researchers ran a group-based protocol for stress related to racism in the VA system. One of the authors was Dr. Monica Williams. I can't remember the first author. That was a great study where they combined elements of like ACT and DBT.
And FAP, probably.
Yeah, and helping people move through that. And there was an ACT and FAP protocol too, or a study where they looked at, again, I think there was Jonathan Cantor, Monica Williams in that group.
Okay.
There was a recent study that I saw where I think this was I'm blanking on the name, but a study where, again, they ran ACT-based groups for Black women targeting internalized racism. And they found like, that was helpful. So I think we can pay more attention to context and be sensitive to context, and use these principles to create a better world.
Yeah. Yeah, that's exciting to think about how, these powerful tools can keep stepping up.
I can hear the baby crying in the background.
Yeah. He's a big baby.
How old is he?
He's 3.
Oh, he's 3. Okay.
Yeah. He has a tendency to wake up from a nap with tears. Could probably do a functional analysis around that and make sense of it. I'm wondering, as you talk about this contextualized work around kind of areas of trauma and maybe intersectionality of different identities, if you could talk a little bit about your work and your areas of interest around this and body image flexibility.
So my main areas of interest are, working with people, working with marginalized or minoritized communities, specifically focusing on like racial ethnic minority populations and sexual gender minority populations, and of course the intersection of those. So like a lot of my work has focused on gay men of color, and you can say that's a lot of research.
We're all drawn to the field for a reason, right? I mean,
yeah, and I think these things come up, and like when I was thinking about dissertation topics or research, I was like, it's going to be hard. I might as well do something that is close to my heart or would like help me keep going. So I think about that, specifically body image flexibility, in ways, the context and environment that we grow up in will engender certain repertoires. Some of those will be related to wanting to change how we look. often, and especially for gay men, there's a huge social pressure to look a certain way. For some people that works. For some people it doesn't. I know for me it didn't. And the thing there is that there's this piece where you can convince yourself that it will work, that if you like just try hard enough, that if you press the lever enough times, or like, you know, try doing it different ways, you can do it. But it's a losing game. And I will, of course, attribute this to this is a Kellyism. It's a game of like, you know, first you lose and then you play. Because like if I need to make my body look a certain way to be worthy, then that assumes that I start with being unworthy. And there is always more. There is always more muscles to have. There is always more body fat to lose. So but it seemed like maybe you were having a reaction to that.
Well, I was muting so I could tell them to be quiet out there.
Oh.
Yeah. Oh. Yeah, but yeah, I mean, I'm definitely having reactions to this idea of, for sure. Yeah.
Do you want to talk about that?
I don't know. Just relating, I guess, you know, relating to that in my own ways. And I don't know how important that is. I don't know if that's a worthy contribution right now.
It looks different. And of course, so my experience has been very different, but it seems like there's a piece of it that you can relate to.
Yes. Yes.
Yeah. And maybe that piece is of like doing that thing of earning your worth by doing something. And maybe that's the spot that I like, that's I think is useful. Like entering that space where you know what that's like. Not to show to me, but to, and like for other people too, to like guide what they're doing. Because I think if you can enter that space and know what some of that might be like, you can ask questions.
Yeah.
That are curious and relevant and might drive me or might move me in certain ways. That could be helpful.
Yeah. Yeah, I'm just thinking about how that has steered me, and I want to continue to make sure that, you know, my relating is helpful and not obtrusive or detracting. And
noticing the problem-solving agenda has come up again. Need to make sure that you do it right. Yeah. So that's, I found that to be helpful. And then I think the piece of the psychological flexibility that translates to body image is seeing yourself as you are. and choosing what matters. I was actually talking about this with one of my friends today, who's also a gay man of color. And I was lamenting about how I'm not a muscle gay, and how much I wish I was a muscle gay. And I mentioned to him that I lament that I'm not a muscle gay, and that makes me sad sometimes. But also, I don't want to be that, because I think moving towards that would require me to give up on other things, like, time reading, or time spent with friends, or time spent talking to family. It would require me to focus exclusively on going to the gym at least once or twice a day. Yeah, and I had the sense that it's sad that I'm not that, because clearly I am losing out on some things. It's sad that I'm not a muscle gay, and I will lose out on some things. And at the same time, I'm choosing something that matters.
So allowing yourself some permission to lament.
Yeah.
Sometimes.
Yeah. And I think allowing yourself to feel what you feel. Another great phrase that one of my other supervisors used is, your feelings are your feelings. His name is Alan Gross, and that has stuck with me. Your feelings are your feelings.
Yeah.
You can't think them away. You can't convince them away. So I have that sadness, and at the same time, that sadness has a place at the table, and not what's directing me.
I'm wondering about this appreciation and your ability to appreciate these elements you just talked about, these feelings at the table, and how that has impacted your ability to appreciate clients' feelings at the table.
I would say, or I like to think that that's created openness for clients to, express what they're feeling, and making space for that too. I'm trying to think, and for example, with one of my clients, I talked about, them feeling shame about something, shame about making a mistake or not meeting one of their goals. And shame is welcome too.
Yeah,
that comes up. I don't think trying to make that go away or trying to demonize it is helpful.
yeah.
So we talked about that, on how that feels, and that again, their feelings are their feelings. Or what else matters? What else in that experience of shame? What else do they care about? What else could come to matter, even if not right now? Taking care of themselves, or taking care of their child. So I think it works dually. It's the principles that apply to me and the principles that apply to the client are the same. So it works in one sense that I'm open in sessions, an openness to whatever comes up. And I think that socially transmits too, and to working with patients then, that they're open to whatever comes up.
Yeah.
And I'm compelled to almost say this, that not that I don't make mistakes or, not that I don't have these things about how I'm not a good therapist all the time, in fact.
Mm-hmm.
And that matters to me. And hence that's something that scares me greatly.
Yeah.
But what if I'm not a good therapist?
Mm-hmm. Scary.
Yeah. Just saying it, I'm like pausing there creates discomfort.
Yeah.
I don't know
I
what
saw that.
you saw that. Yeah.
Yeah. Like they're gonna find you, kind of.
Yeah.
Like they're gonna. Yeah.
Yeah. Yeah.
I'm thinking about, for me on this realm, how important it is, the practice of openness to experience for me, just really come to find in my wise old age that I need to be, taking care of that and tending to that fire in myself, because the work that I did last year on the openness and vulnerability it builds, but it's kind of like relying on that shower I took last month to keep me smelling fresh.
Yeah. I guess as you were talking, I had the thought about, this being a journey, and we're walking, and we'll fall inevitably. We're walking, getting up and walking again. And just moving on this journey.
Yeah, and I didn't mean to say that I'm going to be open all the time, or that I expect that of myself.
Mm-hmm.
But there's definitely periods where, for whatever reason, the shop windows close, and just the comfort of hiding out, and that I can feel that when I'm engaging with our people, and clients or people.
Yeah. Totally. Behavioral variability, right? Like I can't be mindful all the time. I love my time like watching TV, or like losing myself in a book that can be both mindful and mindless. Yeah. I think variability is good.
Yeah. I'm wondering about the term that you mentioned earlier, that if you could expand on the body image flexibility.
Mm-hmm.
What's that about?
I think in a nutshell, I would say that's doing what matters and what's values consistent as related to your body, and being open to internal experiences that come up, whether those might be like expectations about your body to look a certain way, or demands that you might feel, and societal pressures that you might feel you have to conform to.
Okay.
And still noticing that and moving towards values. For example, a thought that I just had was like, noticing my own fat phobia and noticing how that's baked in and built into how I look and how I think about bodies. And noticing that, and that comes up for my clients, and how we can help them or how we can help ourselves to like if being kind and being healthy are values that we care about, how we can act in ways to move towards that, while letting these internal experiences come up and being open to them.
Okay.
I think that I would think of like body image flexibility.
Okay. Yeah, I'm thinking about, I mean, I'm someone who has struggled with body image pretty much, as long as I have memories, and I was very much guided by like how my clothes felt, and if the belt was too tight or the pants, I could feel the one pant leg going on a little tighter than usual. Was a bad day. It's going to be a bad day.
Yeah.
Yeah.
There are action steps that can come out of that, like of that, looking at body image flexibility. And that can be like, what feelings come up when you notice that, like the tight belt.
Disgust. Yeah.
How does it feel to say that?
I don't know. It's a little bit liberating to acknowledge it. Little freeing.
Yeah.
And I guess I also am finding myself thinking about just like how there's a certain like that feeling of the belt or the pant leg is like, oh, that's that's immediately where everyone's going to see first. That's what they're gonna just notice that. That's like wrapped up in that, like yeah.
That's there. Talking about that can be, a willingness exercise. And something else that I might ask is like, if you loved yourself fully, and if you loved your body fully, just as it is, what might you do?
Just talking to myself here. Yeah.
Talking to yourself.
Yeah, I just think I'm having a conversation about what that would look like, what in the moment, how I interact with that and let let that hang out there, and don't respond. I think that I would go. I would.
Let me pause you, and I'm wondering if that was like there was a busyness there and a sense of like, of course, that's not possible.
No.
No.
No. No, I was just kind of going through this, trying to imagine the steps of that, because it's still, it still can happen depending on. It can still happen, and I think there's a certain kind of fetal position that happens in a small way when that elastic is too tight, and like a cowering, you know, and there's probably something there for me to rest with, rather than you know, rush past.
Yeah. Interesting you use like fetal cowering, and seems like, yeah, I mean, rest, love, care
Yeah.
in that space.
Yeah. It is. I appreciate your highlighting that. And
Yeah.
I'm also appreciating your approach of appreciating. It doesn't feel like there's busyness. It doesn't feel like there is a unspoken, we don't have to do anything about this stuff.
Yeah. Yeah. And that's the goal. That's where I'm hoping for.
Yeah.
For me and for people that I work with.
And I'm curious about how if you anchor yourself there, so to speak. Because you know, you get tripped up, I'm sure.
Yeah,
you get,
yeah.
you know, roped in and all that kinds of stuff, you know.
Yeah.
Do you have any places you go for reminders, or kind of a slow down, Yash, stick to home base, Yash, whatever? I mean, what do you do?
I was laughing because I'm noticing just how much, like, in the span of a conversation, my mind can go. And I think that's the mindfulness piece, being present piece, where just coming back to what's now, and what's present. This conversation, this space. And I think that's the practice.
Okay.
Coming back.
The gentle return.
Sorry, what?
The gentle return.
Yeah. And then going away again, and then coming back.
Yeah.
I like to think of it, or like, I guess I view it often as this three broad things, which, again, if you've gone to any Kelly workshop, at least, that you would have heard of, being open, present, and engaged.
Mm-hmm.
And I'd say those are like good monikers or brief descriptors.
Okay. I've heard of this Kelly guy. I think he had something to do with ACT.
Right. Yeah.
I'm curious, as we wind down here, like, how did you get to Mississippi and ACT, I guess, you know?
I just happened to just read about ACT in my last year of undergrad or early master's. Now I can't remember.
That was where were you?
Undergrad India, and at that point I'd applied to like PhD or PsyDs. I knew I wanted to do more, but an undergrad in India is 3 years, so I couldn't have directly gone to a doctoral school, and I didn't have the required experiences or whatever, research too. So I did a master's, and then I applied to like PhDs.
From India?
No, I did a master's in Pennsylvania.
Okay.
In Scranton, Pennsylvania. And then
the
I applied
office.
to PhDs. Yeah. And I'd read about ACT at that point and really liked it. And and just applied to different places. Interviewed at places and met with Kelly, who was just, Kelly's Kelly. And when he made me the offer, I was thinking about various things like moving down to Mississippi, which was a big choice. The financial offer. And I told Kelly that I want to take some time to think about this.
Mm-hmm.
And then I think I called him back maybe the next day and was like, well, there's no way I can turn this down. I'm going to accept it. I'm going to say yes.
Mm-hmm.
And funnily enough, like that has been, there was a precursor of like, I guess, like my time in Mississippi was hard. Being brown, being gay, being an immigrant. And the training was worth it. And the training made it worth it.
Yeah. Well, I'm grateful that has been your path, and you chose that. I'm excited to see your path as you. Are you available for consultation?
It's such a tricky thing being an immigrant. And
what about for folks from India? I mean,
for consult, I can be available. I will find a way to figure that out.
Okay.
I think I'll find a way to make that work for consultation, for research collaborations.
Okay.
I'm interested in research on, again, like LGBTQ plus communities, racial ethnic minority communities. So I think both of those that would be helpful.
Okay.
I appreciate that.
Yeah. Well, thanks so much for sharing your heart and wisdom and experience.
Thank you for having me.
I'll put a link to your contact information in the show notes, and people can find you.
Yeah.
Find you there.
Okay.
All right.
That sounds good.
Thanks, Yash.
Yeah, thank you. Thanks for having me.
But I'm getting stronger. They take a piece of me. But I'm getting stronger. They take a piece of me. But I'm getting stronger. They take a piece of me. But I'm getting